Mayor, as a parent, I know there's no school tomorrow, and you might know more by Monday, but are you at the point where you'd be nervous sending the kids off to school, or nervous going to the ball game tonight, or?
Well, one of my kids is going to the ballgame tonight, so I'm not nervous about that. But I am concerned as a parent about where we go on Monday. And that's why I want to take the weekend, the bulk of the weekend, and get as much information as we can, not only from the great staff here at the Milwaukee Health Department, who has just been working, the staff has been working around the clock since this first hit, and I'm very thankful to them for that. But to get more data, that's why, for me, it's important to have a better gauge of hospital admissions, of the severity of the disease. Clearly, we have seen it in more than one school as it's grown, particularly on the south side of the city of Milwaukee. So I'm very concerned about what that means. And I also understand that parents have jobs, there are daycare responsibilities, that this has the potential of really creating a very stressful situation in our city for families. That's why, when we talked about it earlier today, I said, let's get as much information as we can, talk to the schools, not just the public schools, but the private schools as well, and come back on Sunday so that we can make an announcement as to what we know at that time, knowing that, again, it's going to cause stress in people's lives. But we want to give as much information. And I think some people say, well, are you taking an incremental approach, or should you just take this dramatic approach? We just want to take the best approach, and this is something that is new for all of us. I can tell you, just so people have this understanding, that this morning at 6:35 a.m., the Center for Disease Control issued a new recommendation in terms of school closings, and went from 7 days to 14 days. Now, we have not made any announcements at this point as to length of time, but I think the community should know that that's something that is less than 11 hours old coming out of the Center for Disease Control. That's one of the reasons that I want to have us have more conversations with the Center for Disease Control. Again, because Milwaukee, at least from the information that we have before us right now, is moving, unfortunately, into the spotlight in terms of the number of cases because of this dramatic increase today.
Mayor, what's the threshold for when you're determined to make the closures of large gatherings?
That will be dependent on the recommendations from the Health Commission.
Yeah, we've received guidance from the Center for Disease Control, and as we look at the scale and we look at disease circulating in our community, we will manage that. This requires us to look at the contacts to these probable cases, look at how this disease could be spreading and where it is and how we locate it. That is a lot of work, and work that our public health professionals are conducting even as we speak. We will be as thorough as we can, but as timely as we can, and have the highest level of reliability, that when we make that determination, that it takes into account the transmission of disease and the overall public safety. We take that very seriously, and we're going to do our homework to make certain we get that one right.
What is the recommendation for what these kids are supposed to do who now can't go to school? We've got parents concerned about how do we take care of the kids during the day, and what happens if they just go to another place where they gather, like the mall or the movie theater? Is that not just exacerbating the situation, and we're putting it into a different?
Well, this is advice for voluntarily having these individuals stay at home. And particularly if they're exhibiting any symptoms of influenza. We want those kids at home. And we want those parents and guardians who are responsible for caring for those kids to be in contact with their healthcare provider, to monitor and to be able to get feedback on whether their symptoms are mild or severe. This preemptive closure is to make certain that we curb the spread of disease, and that does not mean that we want one venue to spill over to another. Parents are the best at managing the care of their children. They know them best. Our advice and counsel is to keep them home, to watch them, to look and be aware of changes in their overall health so that you can have dialogue with the health provider and take the appropriate actions as necessary.
Thank you all very much.
Okay, how will you be updating us through the weekend?
Any guess on when tomorrow's briefing might be, or?
Probably should be 3 p.m.
2 4?
2 4, right?
Maybe tomorrow.
But it'll be advised.
We'll put up